Hi, I'm Tamsin Marshall from Beauty Goss, and I'm here with Dr. Teresa Cattin from Faceworks. Now, Teresa is a cosmetic physician who has been training doctors in the use of Botox for over 10 years now. She's on the advisory board for Botox and Juvederm, and she's the president of the New Zealand College of Appearance Medicine. Plus, she's got a fantastic skincare range called Faceworks. So, Teresa, what is Botox?
Botox is a naturally occurring protein which has been purified and is used in many different fields of medicine to temporarily relax smooth muscle.
How does it work?
It just blocks the chemicals that cause the muscle to contract. It's a reversible procedure. Effects last for about 3 months.
So how long does a treatment take, and does it hurt?
No, I don't think it does hurt. It's actually very comfortable. It's probably about the same as getting your eyebrows plucked. And it is a quick procedure. 5 to 10 minutes is usually all it takes.
Wow. What areas on the face does Botox get used?
You know, when it was first developed, it was mainly upper face, frown lines, but now virtually anywhere on the face can be used, and the neck as well.
Wow. How long does it last?
It lasts on average 3 to 4 months, pretty much depending on dose, how much is used.
And how safe is Botox?
Botox is safe. People don't always realise that it's not a new drug. It's been around since the mid-70s, and it's used in just about every field of medicine that you can think of. So there's actually a huge amount of safety data, a huge amount of clinical work behind the drug, and I personally am very comfortable with its safety profile.
Is there such a thing as a typical Botox user?
You know, I think there was 10 years ago. The typical Botox user would have been a woman in the, say, 40 to 55 age group, but now it's completely changed. We're seeing more men having Botox, and we're seeing much younger people having Botox, more for prevention. And I've got to tell you, I've got a lot of elderly patients now having Botox as well. So I don't believe there is a typical Botox patient anymore.
So a lot of people worry about ending up like that sort of Catwoman with a completely frozen face like the celebrities and that you see in magazines. Is that going to happen?
Only if you want to. No, it's your choice. It depends entirely how it's done and how the product is used. It can be done in a very, very natural way, and that really is the trend these days.
How much does it cost?
The cost really depends on how much you use, but it has been calculated out as equivalent to a cappuccino a day.
Wow.
Yeah, so it's actually very affordable.
That's really good. That's not bad at all. Now, I have seen some reports of fake Botox, so can you explain that?
We do know they exist. Worldwide, there is a handful of botulinum toxin products which are safe and are registered. Apart from those, we know that there are a number of counterfeit or fake Botox products which are not tested and are probably very unsafe. And the way to avoid these is to make sure you go to a bona fide clinic.
What's your advice for someone considering Botox?
Find a cosmetic physician that you're comfortable with.
Yes. Start
with a consultation. Sit down with them in front of a mirror and talk about what it is you're wanting to achieve. And a good cosmetic physician will also be able to advise you on how to get a really natural look.